How to use Docman. So Docman is where all of the patient correspondence from the hospital and from the patient or emails, etc., are kept. So the GP documentation is all kept in the Consultation Manager in Vision, but to access the patient's correspondence, you just use this floating toolbar here. You have the patient open and you just then click on this. It will then open the patient's correspondence. If you're dual screen, you should really have it here because most of these things are in A4 portrait format, so it's best to have it there. As you can see, this is a dummy patient, so there's not lots of correspondence, but essentially it's in going back in time, and then they will be in a variety of different clinical folders, respiratory, labs for blood tests, etc., etc. You can, patient correspondence will all be in there as well. And if you want to go back to seeing all documents, you just click on all documents there as well. Your workflow, so results and clinic letters and everything, will also come through Docman, and that comes through this bit here. This will be a colour blue if you don't have anything sitting. It will be green if you have some workflows, some documents sitting awaiting your action, or it'll be red if you have urgent ones awaiting your action. And to look at those in action, you just open this and then click on workflow. And so we have one here for a dummy patient, and so you'll have a list here usually of your workflow or documents needing actioned, and so the way to do that is that every single document needs a comment or a free text comment and before filing. So you have to do something with each document. So for example, with these blood test results, you can just say tell patient normal or whatever, and then you can file it. If you click the wrong one, you can just click that cross to get rid of it, and so these just make it easier to to action the workflow. So for example, if you wanted to mark these as normal, you can click tell patient normal and then finish, and when the patient phones reception, the receptionist will then read out what you have put on here, or for example in this one the patient's thyroid TSH is slightly high, so what you might want to do is, I don't know, repeat the blood tests in 2 weeks or whatever, in which you could maybe free text repeat test in 2 weeks or whatever, and then you click OK. If you want it actioned though by reception, you need to reroute it to reception. So you would reroute that first to whoever you want, so admin staff in this case, save it, and then give them tell them what you want them to do with it. So phone patient and tell them, blood test and repeat blood test in 2 weeks because their thyroid is slightly off, or whatever there. And if you've clicked it by accident, you can just remove that. You can also use the highlight function if there's anything of interest. So for example, if you want to make something more noticeable, you can highlight it like that. And what else do you need to know about this? I mean, you can save reception having to phone the patient, or save the patient having to phone up for test results by just getting in touch with the patient yourself. So if it's something urgent, you can just give the patient a phone, or you can just send them a text. So if you want to open the patient's notes from Docman, you just click on Clinical System, and that will open that patient then in Consultation Manager. And so for example, if you just then wanted to tell the patient that their blood tests are normal, you could just then send them a text, and this isn't working because this is a dummy patient and they don't have a mobile number registered, but you could just send them a text saying your blood tests are normal, or you can send them a text saying, your thyroid test is slightly raised, please phone the practice and have your blood test repeated in 2 weeks or whatever.